My name is Jordan, and I'm going to be inserting a Foley catheter. So first, I'm going to come in the room, and I'm going to introduce myself. My name is Jordan. I'm going to be your nurse today, and we're going to be inserting a Foley catheter. I am going to identify the patient by their wristband. I would check orders to see if they have any latex allergies or iodine allergies, and I can also verbalize that to the patient as well. I'm going to make sure that I have everything that I need for my kit. I have a Foley catheter kit, I have something to measure the wound, and I have a measuring tape. So I'm going to take out my Foley kit. Okay. And I'm going to open away from myself. And then I can adjust with my 1-inch border. I'm going to perform hand hygiene. And now I can put on my sterile gloves. Without touching the outside. Okay. Go underneath the cuff. Just make sure that this way, and now I can adjust my Foley kit. So everything is sterile. I'm going to make sure that my patient is in the proper positioning. They would be more supine with the legs up, like a lithotomy position. And now I'm going to put a drape underneath my patient without touching the patient. And some facilities, they use another drape on top, but for video purposes, I won't be using the other drape. I'm going to make sure that my swabs are open, and I can use the lubricant. And then I'm going to place the tip of the Foley in the lubricant, and I'm going to attach the syringe to inflate the balloon. I'm going to clean the vaginal area. The first swab, I'm going to go on the right side, and I'm going to go hold the labia open, hold down and rotate, go on the left side, down and rotate, and then in the middle from the meatus down. Okay, and now I'm going to insert the lubricated sterile catheter. And I'm going to tell the patient to take a deep breath, and I'm going to insert until I see a urine flow, and then 2 to 3 centimeters more. Take a deep breath. So then now urine would be starting to flow, and I'm going to insert 2 to 3 centimeters more. Okay, and now on this Foley, it indicates 5 milliliters for the balloon. So I'm going to insert 5 milliliters for the balloon. And then now I'm going to check for placement, and I'm going to gently pull until I feel resistance. Okay, and then I'm going to take the little sticker that says my name, my date, and the date that I inserted it, and I can attach it to the Foley bag. to make sure that the Foley is secure to the leg, and then I can hang the Foley bag on the side of the bed, and I can attach the sticker to the side of the Foley that says my name and the date that I inserted it. And now I can discard of my materials. And that is inserting my Foley. Okay. And I'd make sure that the patient has their call bell, and I'd make sure that the bed is in the proper height, in the lowered height, and I'd make sure that they're comfortable, and I would remind them that they have the Foley. And now, upon taking the Foley out, I would have to check for orders to make sure the Foley needs to come out, and I would again come in, I would identify myself, I would identify the patient, make sure it's the right patient, I would let them know that the Foley is coming out. This is a clean procedure, so I would put on clean gloves. Make sure. We're going to be taking your Foley out. So I would just tell the patient to take deep breaths, and I would get a syringe so I can deflate the balloon. Okay, apply this out. And then I would hold it closest to the insertion point, and I would ask the patient to take a deep breath, and then I would pull it out. I would discard. And then at this point, I would give the patient the call bell, and I would let them know if they need to use the bathroom, that they should call me, and I would be monitoring the patient's eye and nose, make sure the patient's comfortable, and I would remove my gloves. I could perform hand hygiene and document everything that I found.